Good evening, Dr. Mike.
Good evening, Doctor.
As a very experienced trichonologist, you must be coming across a lot of patients with complaints of hair loss. So how do you approach them?
Well, yes, hair loss is a big subject at the moment, and we're seeing lots more people with lots more awareness, and those people that are struggling with hair loss. And there's a variety of both male and female. So in particular, people are now becoming more educated and they know where to go to get help. So that's where we're seeing difference of diffuse alopecias, and we're seeing androgenetic alopecias and alopecia areata. So we're seeing the whole spectrum.
A lot of patients are there who have hair falls, and often they imagine that the hair transplant is the only solution. What do you suggest them about as a preventive measures, or something that will, of course, all of them may not have this problem solved, but to prevent this from happening?
Yeah. Well, of course, the transplant is the only permanent cure for baldness, as we know. But there are lots of things that people can do before they get to that stage. So, as a typical treatment, the first and the most important part is the correct diagnosis. So we need to understand why they're losing hair loss, particularly the difference between male hair loss and female hair loss, because it's clinically different. And if it's a female, we would look at the nutrition, the hormonal imbalances, possibility, stress factors, nutritional factors, and then we could offer a range of treatments. So that they would range from topical treatments, supplements, and also then we would move into more aggressive, as in meso, PRP, which is obviously your specialty, and then the final result would be a transplant.
So it is possible for the people, for a typical patient who is losing hair, to at least delay the inevitable, that is the hair transplant.
Yeah, and if we're seeing people that are just shedding hair, then we've get very successful results on certainly slowing down that shedding and holding off for a transplant, maybe a little bit longer. But if it's genetic, then we usually end up at some point at transplant.
Right. So what I understand that as a trichologist, your opinion is that the people who are losing hair need not worry, that they may not need hair transplant only, and there are various non-surgical methods available which can take a lot of problem away from them.
Yeah, there is no need now to think that your only option is a transplant. We're coming so far along now that there are many treatments that we can implement before we get to the transplant stage. Then if we do have to do a transplant, then it's certainly an option.
Yeah, as a plastic surgeon, definitely we do the hair transplant, but as we understand that hair transplant, it does give a permanent solution and effective solution, but that's not where it ends. It has to the patient still has to continue with the medical management like PRP, lotions, and other things, because they've got remaining hair to be looked after.
Yeah, well, sadly, because it's such a large industry now, lots of clinics they do the transplant and they send the patient on the way, and that's not what we advocate. It's a case of, it's a whole management system. So once they've had the transplant, that's not where their care ends. We need to protect their existing hair and look after them and support them in the following months to protect the hair that they've got.
Right. So we are looking at a comprehensive hair management program with a multi-prong attack, so that which is non-surgical, which helps them a great deal to retain their hair.
From diagnosis to all the way through to treatment, and then to follow up and look after them as they recover, whatever treatment they have.
Yes, but that was quite enlightening to us as a plastic surgeon. Thank you.
Okay.